Hello, this is Dr. Sukalyan Purkayastha. I'm a neurointerventionist, and today we'll be talking about intracranial, that is brain angioplasty and stenting for intracranial atherosclerotic disease. That means it's being a bit of technical term, like the fat deposition or cholesterol deposition inside the brain arteries, and thereby narrowing those arteries and forming stroke. So how we treat those patients, because interventional technique is the only way to go other than medical management, but because the role of open surgery is very minimal in treating this sort of disease. So this is a slide where you can see that I've kept it how the brain arteries look like. Okay, you have the internal carotid arteries, the basilar arteries, and each artery can get affected with atherosclerotic disease and the stroke and resulting stroke from this disease process. Now, what is the disease burden? Around 8 to 10% of all stroke can happen because of the atherosclerosis of the intracranial arteries, and it's more in Asians. So that is another important thing to understand. And the way it forms stroke, it may be a bit different from the other stroke mechanisms, because the brain arteries are very small, maybe around 2 millimeter vessel, 3 millimeter vessel diameter, and if 3 millimeter vessel gets narrowed in a particular area with the plaque deposition or cholesterol deposition, you can imagine how much is left for the brain circulation to happen. So here is an example. The patient this is an MR scan where you can see a small white area. This is a diffusion weighted scan to detect stroke, and you can see a small stroke here. And this is the angiogram. You can see the focal narrowing of the brain artery. We call it middle cerebral artery, where it is stenosed. And this image is showing the stent placement across the stenosis, and this is how a stent looks like inside the brain. And this is after stenting. You can see that the vessel looks more or less normal, and you do not find where the stenosis was. And this is how you prevent stroke which is arising from the intracranial stenosis. And this is the scan, what we do after the stenting. You can see that there is no further stroke happening because of the stent placement. Now, this is another example. I'll just finish it with another example. You can see that the cavernous carotid artery, again, this is another technical term. The carotid artery is the artery which goes from the heart to the brain, supplying the brain. And this is a focal narrowing here. And this narrowing is probably more than 95%. And this is the first we have inflated with a balloon, and this is the stent placement, and this is how a stent looks like in fluoroscopy. And this is the condition of the vessel after stenting. So you can have kept a small image, the pre-stenting image in the inset, so you can compare how the vessel looks almost normal after stenting. So this is another example, long lesion, and this is how the stent is put. And so in conclusion, I can tell that if the narrowing in the artery, in the brain artery, is more than 50-60%, then obviously, and if it is symptomatic, if the patient is experiencing stroke or TIA because of this narrowing, this is the only way to go. And this stenting is actually not that difficult. It's safe in experienced hands. So, and it can be done in internal carotid artery, middle cerebral artery, vertebral artery, basilar artery, which are the usual arteries where the stenosis happens in the inside the brain, and that forms stroke. So the patient has to be on blood thinner, cholesterol lowering agent. He or she has to modify the lifestyle, should quit smoking, should not be taking too much of oily feed, should be doing regular exercise along with the treatment to prevent future stroke. Thank you very much.